Hi everyone, I'm Charlene Rockamora. I am a nurse at Kaiser San Diego in labor and delivery, and today I'm going to be teaching you about the yes and no's of nitrous oxide administration. Our hospital is going to be implementing this new pain management option to our women who are laboring, so I figured it was an important lesson to teach to my staff RNs. So that they have this important information. For my lesson plan today, I did embed a video and a PowerPoint. So in case you can't hear the video or you want to see the slides more closely for my PowerPoint, I will be adding links to both of them on my discussion board so you have full access to it and they should be easier for you to view. Thanks. Today we're going to be talking about the yes and no's of N2O, which is nitrous oxide. Again, I'm Charlene Rockamora, and I'm going to be teaching you about nitrous oxide administration. So to help my staff RNs learn how to administer and take apart the equipment for nitrous oxide, I actually created a video, which we're going to watch today. This is your nitrous machine. It shows you your nitrous pressure, your oxygen pressure, and the pressure of the mixture together. You want to make sure you have 2 full tanks. This tank is full. We don't have a second one just yet. We're still waiting on that one. You want to make sure your scavenger is attached. This is the scavenger. This piece right here. And you want to make sure your setup is correct for your nitronox. If it is not connected to your nitrous oxide, simply line up the pieces and you're going to hand tighten it. To open the nitrous, you're going to give it a full 360-degree turn. You should see your pressure gauge drop or increase to about 750. That tells you you should have a full tank. To shut off your nitrous, give it a full backwards, counterclockwise turn until you feel tension. Nope, that the pressure gauge doesn't change. It still stays at 750, but your nitrous is off because it is hand tightened. It will stay on at 750. The first step is to take your demand valve and you're going to plug it into your Porter Nitronox machine. It's going to go right here. You should hear it click. And then it gets placed right here. And on the back of your machine, you're going to see a little gate. When you close the gate, this line should align. This piece here. And now it's closed. And you can use this knob to tighten it. Connect your oxygen to the wall. Now connect your vacuum to the wall. Next, you're going to take your patient tubing and attach it to the demand valve right here. You notice the blue is the part that's getting connected. Make sure all these caps are tightened. There should be 2, one there and one at the top right here. Those should both be tightened. And that prevents leakage of nitrous oxide into the room. Next, you're going to connect the pink tubing to your scavenger. Pink goes to the black piece. To ensure the nitrous oxide is completely evacuated into the system of the hospital, make sure that this valve is pointed at the 6 o'clock direction. If you hear this sound, that means your nitronox is connected correctly. connect your mask to the Nitronox machine. And now your nitrous is ready to use. To take apart the nitrous, you're going to make sure that your nitrous is closed all the way. Hand tighten it. And you're going to make sure your scavenger is set to the 9 o'clock position. That makes sure that your vacuum is closed. Disconnect your vacuum. Disconnect your oxygen. Next, you're going to take off the patient mask and connections. And these are one-time use only. So these pieces, the mask, the blue and the pink, all together get thrown away into the red biohazard bin. Cavity wipes, Sani cloths can be used on all parts of the machine except for the face. Per the manufacturer, they would like us to use alcohol to wipe the face, as the Sani wipes can possibly cause condensation to build up within the dials. Demand valve pops out, and there is a release button right here. You can wipe this with the Sani wipe. Do not take it apart. Leave it together in one piece, and this goes back into the Pyxis under your patient's name that you pulled it out from underneath. Once you have wiped down the nitrous machine, please make sure you place it back into the medication room where it can be stored. If you have emptied your nitrous canister, please ensure that you replace it with 2 full ones. Please talk to your charge nurse regarding where you can get a full canister of nitrous oxide. According to the manufacturer, the nitrous machine is safe to use with COVID-positive patients. The most important thing to remember is that the patients must inhale and exhale completely into the mask if they are to use it properly. This minimizes the exposure of aerosols generated by the patient. All right, so that's our movie. So once we finish the movie, let's go to the next slide. The nurses would go to a patient room and they would actually participate in hands-on training, their competency sign-off, and their quiz. So the participants would be allowed time to practice and set up disassembly of the equipment with their peers. The participants will be evaluated on their ability to set up and disassemble the nitrous oxide. A competency would be assigned and completed by the educator. And the manufacturer did give us a quiz that they wanted us to correct and grade together. It's not like a make or break kind of thing. It's just kind of a things to remember quiz so that RNs are aware of it before they administer nitrous oxide. Another part that I would be incorporating into my lesson would be the QSEN video called Promoting Interprofessional Collaboration Practices. Because our nurses are not the only ones who will be affected by the administration of nitrous oxide, we actually have a team of people that help take care of our laboring patients. So it's not just the RN. We're counting on our doctors, our midwives, our HAs, which are our healthcare assistants who might put away equipment for us, and especially our anesthesiologists as well, because they are in charge of the nitrous oxide for our floor. So I would also show them this video. After viewing that video, I would also go through the policies and procedures for our hospital. Again, this is a new tool that or a new medication that we are implementing. So it's very important that the nurses are aware of the policies and procedures for the nitrous oxide for the hospital, so that they know the correct way to give it, just to ensure that they're practicing safely and within the rules and regulation given by the hospital. Participants will also be given handouts that the manufacturer gave us. They're just quick study guides or charts that show the sample setup of the nitrous oxide. So these are examples of the handouts that the manufacturer gave to us. After reviewing the handouts, we're going to go through the QSEN strategy, the staff RN perspective on evidence supporting practice, which is from QSEN. In this short discussion, we're going to discuss the evidence-based practice regarding nitrous oxide administration. I did perform a literature review about nitrous oxide administration, particularly because a few of our nurses voiced concern about being pregnant themselves and the risk of exposure to themselves and their baby when exposed to nitrous oxide. So I actually did perform a literature review to find out if it was a big threat or a big issue for these nurses. And it turns out it's not. It's very, very safe due to the equipment that we're using. I also thought it was important to determine what staff RN's perspectives are for nitrous oxide, whether they've used it before, what they've heard about it, and then to make recommendations for implementing nitrous oxide on the floor and having a successful implementation of it once we first started. At the end, participants will be allowed to ask questions, and we'll have a question and answer session, and then the RNs will fill out an evaluation for the class to determine the effectiveness of the teaching. And this would be the end of my teaching lesson. And here is a list of the references I used to create this lesson plan. Thank you so much for watching my teaching lesson today. I hope you enjoyed it. Have a good night.